surgery was done to correct or to remove that ectopic pregnancy, then you can develop secondary tubal blockage from that surgery. Okay, so a history of tubal surgery can give you tubal blockage. Okay, you can also have accumulation of fluid on the tube, or just something like a blister forms inside the tube. That is what we call hydrosulfinics. That one can also block your tubes and make it so difficult for you to get pregnant. So what's up guys, welcome back to my YouTube channel. I hope you guys are doing good. So welcome back to yet another episode of Learning and Health Talk. So in today's video I'll be talking about a few and very important things or points or things to note as a woman or a trying to conceive couple or women who have been struggling to get pregnant. So sometimes getting pregnant is so easy, and especially when you don't want to get pregnant, but when you decide now you want to get pregnant, it becomes a bit tricky. You struggle because of different reasons. So that is what we'll be talking about in today's video. Yeah. So basically this is about infertility. So as we all know, we have two types of infertility. So we have primary infertility and secondary infertility. So for primary infertility is for any woman who is really struggling to get pregnant for the first time. That means she has no history of pregnancy at all. She has never been pregnant before, and now she's trying to get pregnant and she's not able to achieve that pregnancy. So that is what we are talking about today. And also for women who have been pregnant before, they have a kid or kids, and now they're trying to add more kids, but they are not able to make it, or they're not able to achieve pregnancy, So that is about primary infertility and secondary infertility. Another point that you really need to note is that there is a big difference between being infertile and being barren. So most people confuse the two, and most people think that when someone is diagnosed with infertility, it means that you're barren and you'll never get pregnant. So infertility is all about modifiable factors and things that you can change to make one achieve pregnancy or get pregnant, But when we are talking about being barren, then that means that there is nothing, absolutely nothing that you can do to get someone pregnant. Okay, so for example, or for cases like when someone is barren, most of the times barrenness is brought about by congenital malformations, and especially in the reproductive system. So that means regardless of the interventions, it is so hard for someone to achieve pregnancy. Even if you try IUI or IVF, still you're not able, or you're not still in a position to get pregnant. Okay, so that is all about today's topic, or today's video. So that is what we'll be talking about. So normally women are always falling under the blame game. They always lose when it comes to blame game. So most men do not accept the reality of, or a possibility of them being unable to impregnate a woman. Remember, for pregnancy to exist, or for someone to achieve pregnancy, then two parties must be involved. The man and the woman play a vital part to achieve pregnancy, or for a woman to conceive. Sometimes the problem is actually not the woman, but the man. But if you try and tell him, probably you have the problem. And let you not make a mistake that he has another kid somewhere. It is actually not easy to convince him otherwise that he could be having the problem. He does not, or most men do not understand that bodies keep on changing. Probably when he got that kid elsewhere or with some other women out there, probably that person was living a very good life. He was not under any influence, he was not smoking, he was not drinking, but now he has learned a new behavior or a habit. He has adopted a new habit of drinking or smoking. That one can affect his ability to impregnate women. But if you tell him that, I'm sure if not through a healthcare provider, then it is so hard to convince them as their wife or as the woman in that relationship. It is so hard to convince them. So we have different causes of infertility. So we'll not be talking about barrenness, we'll be talking about infertility. Remember, I've said that infertility is all about things that you can modify, modifiable factors that after modification or just after doing some 1-2 interventions, then that woman is able to achieve pregnancy. Okay, so number one, we'll talk about PCOS or polycystic ovaries, or what we call or refer as to polycystic ovarian syndrome. So this is a condition that is actually on a rise. I don't know if we have an outbreak of this, but it is actually on a rise. Very many women are experiencing this. Very many women are being diagnosed every day with polycystic ovarian syndrome. Okay, so we'll come to learn on the reasons why women are getting this, or the possible reasons or explanation as to why there is a sudden rise in cases of PCOS. So polycystic ovarian syndrome just refers to a condition whereby the ovaries decide to enlarge. They become bigger than the original size or than the normal size. And then there are some small cysts or some small like pimples that form on the outer surface of the ovaries. So that is what we refer to as polycystic ovarian syndrome. Okay, so it is affecting quite a good number of women, and some of the signs of polycystic ovarian syndrome include prolonged bleeding. Normal periods last between 2 days and 7 days to a maximum of 8 days. On the 8th day, it should not be active bleeding, it should be spotting. So that means you can do without a pad, you can just survive with that or on a panty liner. Okay, so prolonged bleeding, heavy bleeding, such that you're soaking more than 3 pads in a day, soaking 4, 5, 6, 7, 8 pads in a day. So that is a sign of PCOS. There is also growth of facial hair, or what we call hiatusm, growth of facial hair, hair on your arms, your legs, your abdomen, your chest, and also some beards. That could be a sign of PCOS. There is also significant weight gain, so you gain a lot of weight within a short period of time. And again, if you try to work out to lose that weight, then it becomes so hard. So women with PCOS, they gain weight because of hypersecretion of hormones produced in their ovaries, that is estrogen and progesterone. So when they try to lose weight, they will really struggle. So there is significant weight gain. So women with PCOS, they struggle to lose weight, but they gain weight so fast. Okay? So among other signs and symptoms of PCOS, not to forget irregular periods. Some women miss periods, others get heavy periods. Okay? So amenorrhea can also be part of signs and symptoms of PCOS. So that is one of the reasons why women do struggle to get pregnant. The other reason is about endometriosis. Endometriosis is a condition whereby you find that we have some tissues that grow or that are found inside the uterus. Now, when these tissues decide to grow on the outer surface of the uterus, that is what we refer to as endometriosis. So women who have been diagnosed with endometriosis have been found to be struggling to get pregnant. The next possible reason or cause of infertility is what we call endometrial hyperplasia. Endometrial hyperplasia is a condition whereby you find that we have the endometrium lining, the innermost lining or layer of the uterus, and due to different reasons like excessive use of postnatal, then habitual use of, or you're just so used to using Depo-Provera as your family planning of choice, then you develop this. So there is excessive thickening of the endometrium lining, so that or such that when fertilization takes place in the fallopian tubes, definitely the fertilized egg or the zygote moves towards the uterus for implantation. So when you have endometrial hyperplasia, it becomes so hard for implantation to take place because now the endometrium lining is thicker than it should be. So it becomes so hard for you to get pregnant with endometrial hyperplasia. We also have other causes like ovarian cyst. Ovarian cyst is just, accumulation of fluid inside the ovaries. Most of the times it is fluid. But of course, you have to note that we have two types of ovarian cyst. We have a fluid-filled ovarian cyst. It looks like a blister. A fluid-filled ovarian cyst looks like a blister. I'm sure you know, or you're conversant, or you have seen a blister. So a fluid-filled ovarian cyst looks like a blister. We have a hemorrhagic ovarian cyst. A hemorrhagic ovarian cyst, it looks like, I'm sure you've seen someone just hit themselves or their fingers on a hammer, trying to nail some piece of or a nail on a piece of wood on the concrete wall. Then accidentally they just hit their finger, and then on the site of impact, there is some dark stuff that forms. It's like a hematoma. So that black thing that looks like blood that has clotted from the inside, that is what we call, that is how a hemorrhagic ovarian cyst looks like. So to manage a hemorrhagic ovarian cyst, surgery is required. But for blister, like or fluid-filled ovarian cyst, you can use medication to clear this ovarian cyst, okay? So if you have ovarian cyst, mild, moderate, or severe cases of ovarian cyst, then you must manage that so that you can get pregnant. Otherwise, you will struggle to get pregnant. Another reason why women struggle to get pregnant is when they have fibroids. Okay, so we have three different classifications of fibroids. We have, and of course, fibroids are named depending on the site, or anatomical location or position of these fibroids. But I'll just not go into deep details about that. I'll just need you to understand about these main classifications of fibroids. We have small-sized fibroids. These are fibroids that measure below 5 centimeters. Any values below 5 centimeters in 3 dimensions. We also have moderately sized fibroids. They measure above 5 centimeters but below 10 centimeters. Huge or big sized fibroids measure above 10 centimeters. So for small sized fibroids and moderately sized fibroids, they respond well to medication. So you can do chemotherapy to manage these fibroids. But for huge sized fibroids, most of the times you just have to do myomectomy surgery to remove those fibroids, okay? So when you have fibroids, you can struggle to really get pregnant, okay? If you also have polyps, polyps are just similar to fibroids, but now polyps are just finger-like projections. They are growths, but they are finger-like projections. So if you have the same way you struggle when you have fibroids is the same way you struggle if you have polyps. If you also have pelvic inflammatory disease or PID, you're also likely to struggle to get pregnant. So if you've been diagnosed with PID, you have to make sure that you treat PID completely so that you don't struggle to get pregnant, okay? We also have blocked fallopian tubes. Blocked fallopian tubes can be blocked due to different reasons. For example, if you have had an ectopic pregnancy and then an ectopic surgery was done to correct or to remove that ectopic pregnancy, then you can develop secondary tubal blockage from that surgery, okay? So a history of tubal surgery can give you tubal blockage, okay? You can also have accumulation of fluid on the tube, or just something like a blister forms inside the tube. That is what you call hydrosulfinics. That one can also block your tubes and make it so difficult for you to get pregnant. There is also the issue of anovulation. Anovulation is just when you as a woman is not ovulating, and it is so clearly that you're not ovulating. It is possible to ovulate and not get periods. Same case, it is possible to get periods and not ovulate. So maybe you have regular periods but you're not ovulating. So you have to manage anovulation for you to get pregnant. So you have to know if you're ovulating. And of course, we have the so obvious signs of ovulation, including breast engorgement and tenderness, and sometimes breast pain. Okay, we also have heightened sense of taste and smell. You become so sensitive to taste and smell. Okay, there's also a rise or an increase in basal body temperatures. You just touch yourself, if you just feel you don't have fevers, but you feel you have heat. So an increase in basal body temperatures. There is also right or left lower abdominal pains could be a sign of ovulation. There is also clear stretching like cervical mucus, an indication of fertility. That could also be a sign of ovulation. Okay, there is also a rise in sex drive. You have more sex desire than before. That is also a sign that you're just about to ovulate. Okay, so an ovulation is also another reason why women don't or struggle to get pregnant. There is also the issue of body weight. So if you're obese, you struggle to get pregnant. You need a healthy body weight to get pregnant. So if you're obese, you're likely to struggle to get pregnant. So if you're also underweight, you struggle to get pregnant. You need to have a healthy body weight. So if you're obese, you have to work out and lose weight. You have to calculate your BMI, your current height, or your height divided by your current body weight. Either your height in feet or in centimeters, then divide by your current body weight. Then you get your current BMI. Okay? So if you're also underweight, you have to gain weight to a reasonable or to the normal BMI, so that you'll be able to get pregnant with no issues. If you have, or if you're diabetic, you have to control your blood glucose or your blood sugar. That means you have to manage your diabetes. If you're also hypertensive, you have to manage that. If you also have thyroid diseases like hypothyroidism, you must manage thyroid diseases so that you'll be able to get pregnant. Otherwise, if you don't, then you struggle all your life to get pregnant. Okay? So also when it comes to men, if you have low sperm count will affect the ability of a man to impregnate a woman. Lifestyle also. Smoking too much alcohol will affect your ability to impregnate any woman. Okay? So we have so many things that actually hinder or affect a woman's ability to get pregnant. There is also psychological preparedness, or mental health also plays a big part when it comes to getting pregnant as a woman. I'm sure you've seen people who have been pregnant, they have stayed for so long without delivering. Not that they have fibroids or any growth, but because psychologically they have been having this strong urge and desire to get pregnant, they got what we call a pseudo pregnancy. It is possible to have a pseudo pregnancy. You're getting all the signs of pregnancy, but there is no fetus that is growing. Okay? No fetus that is growing. Yes. So psychological preparedness. You must also be psychologically prepared to get pregnant. Okay? You must also stop using P2 or postnatal or emergency contraceptives, or also what you call morning after pills. You must stop using them like peanuts. Ideally, you're supposed to take postnatal for not more than 2 times in a year. 2 times in a year. Okay? So you use them not more than 2 times a year. Postnatal. There's also the issue of Depo-Provera. So if you're using any family planning, or if you're not ready to get pregnant, then the idea of using family planning comes along. Okay? So if you have to use family planning and then you want to still get kids after your desired period without getting pregnant is over, then you must avoid using Depo-Provera. Depo-Provera gives you a prolonged delay in fertility return, so you will really struggle to get pregnant. And for those who have used Depo-Provera, that 3-month injection, you know how it frustrates people. You get heavy bleeding, irregular periods, you miss your periods for the longest time. If you try to get pregnant, you struggle. You do all the fertility tests, all the scans available, everything is normal, but you still cannot get pregnant. Why? Because of the effects of Depo. Okay? So if you have to use family planning, if you must use Depo, if it is the only available family planning, then make sure you don't use it for more than 2 times a year. That is equivalent to 6 months. 2 shots in a year, 6 months. Okay? So that you don't struggle. Actually, women still struggle even after using it once. So why should you use Depo-Provera for 2 years? 1 year, 2 years, 3 years, 5 years. The more you use Depo-Provera, the more you lower your chances of getting pregnant faster. Okay? So you have to check on that. Huh? So among many other reasons why women do struggle to get pregnant. Okay, so I hope you've learned. So if you've been struggling to get pregnant, you can contact me through the contact details on the down the video. You can see that is the contact to contact me through. Reach me out through that contact. You can also pick the same contact from my TikTok for those who follow me from TikTok. Make sure you contact me so that we can maybe book an appointment. You come, we do the consultation, we do the screening and the test so that you know where the problem is. Then maybe I'll be able, or I'll be in a position to assist you so that you can get pregnant, be a mom, nurse your own baby, and you'll be a happy mother. So I hope you have learned a lot from this video. If you have any question, make sure you leave the question on the comment section, and I will make sure that I've answered that question. So don't forget to subscribe if you've not. Don't forget to leave a comment, like the video, share the video with your friends so that they also learn. And please don't forget to turn on the post notification bell so that you can be notified every time I upload new content.